All right, good evening, ladies and gentlemen. We'd like to welcome you to our joint webinar with OSAC and ISC Squared on the subject of enterprise risk management relationship between the traditional security and cybersecurity. So we'd first like to start by welcoming our AmCham members in Kuwait, OSAC members, ISC Squared members, as well as the AmCham members of Abu Dhabi, Dubai, Bahrain, Oman, Saudi Arabia, and Qatar joining us today. My name is Paola De La Roche, and I am the Executive Director of AmCham Kuwait. We thank you for joining us this evening because this event will navigate traditional and cybersecurity within different industries, including healthcare, banking, oil and gas, as well as national and international security. The goal of the event is to bring awareness to the crucial relationship between traditional security and cybersecurity, as we're currently living in an era in which the cyberspace is used daily, which has created a convergence of the physical and digital domains, making it crucial for entities to understand that unifying both is necessary if entities want to ensure that their assets are protected as they can be. I now would like to give the floor to OSAC's co-chair, Dana Winner.
So, thank you very much, Paula. Paula is the Executive Director of the American Chamber of Commerce, Kuwait. We have really appreciated collaborating with the AmCham and with Paula over these last few months to bring this really great presentation to you. We're referring to this as a sort of mini conference, and we look forward to further joint meetings between AmCham Kuwait and OSAC in Kuwait in the future. I'd like to briefly introduce OSAC for those who aren't familiar with it, and I'll also briefly introduce ISC Squared. So let's to the next slide. So the OSAC, it means Overseas Security Advisory Council. This is a U.S. government agency in Washington, D.C., and there are councils all over the world. OSAC, Overseas Security Advisory Council. So we are the OSAC in Kuwait. Our steering committee is composed of the co-chair public sector, which is the regional security officer, Jeffrey D., who sadly for us, just came to Kuwait and had to go on his leave. But he'll be back with us next month, and we look forward to all meeting together with him at the earliest opportunity. He will be represented in this meeting by his Deputy Regional Security Officer, Aaron Engstrom, who I will introduce in a moment. The co-chair, private sector for the OSAC in Kuwait, that's me, Dana Winner, and our deputy co-chair is Dr. Bana Azizi. Our secretary is Robin Ward, treasurer Crystal El-Shati. We also have Joan Kaji and Dr. Musayed Al-Najjar on the steering committee for OSAC. The ISC Squared, you'll see why we need a nickname for it, because the full name is International Information Systems Security Certification Consortium. Too long to go through every time, so ISC Squared. And our board of directors in Kuwait is Tom Gamali, I'm the VP, Secretary Fatma Fouad, Treasurer Sintil Kumar, Public Relations Abdulaziz Al-Hamoud, and membership led by Ahmed Hassan. So that's just to give you an idea of the people who have contributed to organizing this meeting and getting the word out about this meeting, this mini conference, as we're calling it. Next slide, please. There's a bit more information about the OSAC. The OSAC is a public-private partnership between U.S. government and the private sector entities around the world to help American, or I should say USA companies, to stay safe in all the countries where they're working. And there's information sharing, knowledge and information sharing on a bilateral basis between Washington and all of the OSACs. Next slide, please. And the ISC Squared is the world's leading cybersecurity professional organization. The certification that you might be aware of is the CISP, the Certified Information System Security Professional.
I would like to introduce Laith Alisa, who will discuss the topic of cybersecurity within the healthcare sector. So Laith has 31 years in ICT, and Laith's career included enterprise service management at organizations like Booz Allen Hamilton, DLA, and Novartis. During the past 12 years, he shifted his career focus to public healthcare information technology, healthcare digital transformation, and headed a nationwide healthcare digitization project. Laith worked with several government agencies to assist in electronic records policies, patient data security, and privacy-related issues. He also has spoken at major regional healthcare events and participated in many panels of discussions related to challenges, risks, and strategies in relation to the healthcare sector. Laith, the floor is yours.
Thank you, Paula. So let's start with the first slide so we could talk about the topic. The main topic that I'm going to discuss today is the privacy part, because this has been one of the largest issues that have popped up, especially after COVID. The discussion is going to start with just quick definition and introduction about the privacy in the healthcare and what's the relationship between cybersecurity and healthcare, and why is the healthcare cybersecurity different than other standard corporate or, for example, cybersecurity. We're also going to just briefly talk about what is private protected healthcare information and HIPAA. So let's start with the healthcare and cyber. A very good article from Deloitte that I have read in preparation for this, and it talks about how is the cybersecurity role and protecting the safety of the data playing in the recent 2 to 3 years. Okay, because the industry itself is going to have a very large scale disruption. The future, as you are aware, is going to be in what we call the big data. There's a lot of big data collectors these days, and healthcare data is one of the most important data segments that people think that nobody is following up or trying to obtain access to or target of a cybersecurity attack. So the bottom line is protecting the safety and the privacy of data is going to be critical in the next stage of healthcare in general. Next slide. And is it currently under threat? Yes, it is. And I've brought in 2 examples. This is one example from the EU statistics. European Union is an agency for cybersecurity. It says that healthcare and medical is number 4 on the target with 143 attacks between April 2020 and July 2021. So yes, healthcare and medical data are target, and they are prime target. The cost of the medical record is actually much higher than a banking record if you could obtain that information. Next slide, please. And the next one is from the Office of Civil Rights, the U.S. HHS, Human and Health Services. Okay, they are investigating almost 860 data breaches in the past 24 months. So that shows you that healthcare is a prime target for the attackers in cybersecurity. Next slide, please. So why is it different? When we talk about cybersecurity, we talk about credit cards, we talk about identity theft, we talk about a lot of things. But there's something that a lot of people don't see when it comes to healthcare. Next slide, please. The most important part is there are many, many stakeholders here. And all these stakeholders must have access and must provide access to that data, from healthcare providers, insurer companies, pharmaceuticals, biotechnology, and medical device companies. Next slide, please. So all of these entities are stakeholders, and they have a saying and a concern and they own data. If you see on the right of the slide, this is part of the current challenge that we have. All these are pieces of the big puzzle. Who has the data or part of the data? How is the data correlated, gathered, accessed? So all of this is done on a cloud platform, which of course raises the big question is, how are they talking to each other? Who's sharing what information? And who has what we refer to as the critical and sensitive information? So the main role here is to protect organizations from external and internal cyber attack. And where the challenge happens is ensure availability of medical services, proper operation. So this falls under a lot of classifications related to, well, we have to have this data because it's life-saving, or we have to have this data because the patient needs it. So it's really hard to control specific parts of the data, especially when it's being exchanged between different providers. So one of the biggest and newest concepts in the health record is what they refer to as the complete health record. And this is a little bit where the challenge starts. You have connected devices at home. You have medical devices connected at home. You have providers that are focused only on one part of the electronic medical record. Then you have the pharmacy who uses patients' data in a different way. Today, they're tracking, has he used the medication? Has he did the refill? And you also have behavior data. And we're going to talk about that a little bit. I mean, Google is tracking a lot of your medical searches, symptom searches, medication searches, tying up to a persona and adding it to the rest of the what they refer to as the complete health record. You'll be shocked to know that even your personal health record is part of the data that they're gathering, collecting, and combining together. Next slide, please. So the largest reference that we always go back to is the HIPAA privacy rule. Why do we use that? Because that's actually the standard in the most of the providers of the EMR and EHR companies. So it basically defines the privacy rule that applies to protected health information as individually identifiable health information, and it says that it includes demographic data. And a lot of people miss that point. It's not just about your reports, medical reports, health record. It's a lot more than that. So you'll see that it says any data that refers to individuals' past, present, or even future physical or mental health or condition. So the status that you're in the past, in the present, in the future is considered a protected health information under the privacy rule. The second type of data is provisioning of the healthcare to the individual. What services you've received, what kind of healthcare have you had in the past? Are you part of a family type of health plan? Are you using different resources, internal or external in healthcare? And the last, and the part that is always missed by us as patients is that the past, present, or future, the payment is something that is very important and it's tied up to a provisioning of the healthcare. So your insurance payment, it's a protected health information. Also, payments for medication that you make is supposed to be under the same rule. So in general, all that data, we always have the concept that we perceive that the only important data is going to be gathered and collected only through the care provider that we're in. So we think of ourselves, let's just say I'm going to get admitted. Then I got admitted to the hospital. I'm assuming they have an EMR. So now they have my doctor's notes, nurse's charts and notes. They have my lab results. They have images and reports, my medications. And then when I went home, I was, for example, was supposed to track my glucose level. I'm a diabetes patient, and I'm supposed to provide that. So in the back of our head, we always remember that it's just about this visit, and then this data disappears somewhere. That's not accurate, and absolutely not true. Let's go to the next slide. Because if you just look at the same slide we looked at earlier, it says physical or mental health or condition, but past, present, and future, which means that they are tracking and keeping this information. Although they're labeling it as privacy rule, they're also keeping what provision of healthcare services you've received, if there's any ICD classification of your disease or illness, and also how did you pay for that service? How did you pay for all the other parts of services? Plus, they have the common identifiers on the same record. Your name, your address, your date of birth. In the States, they track social security number. Here in Kuwait, they will use the civil ID. So that's the set of data that we went to a hospital, provided, and left, figuring, well, my information is just stored based on that. So if you go to the next slide, it's actually a much, much larger, because your healthcare journey is not based on an encounter, a single visit, a doctor's appointment. It's a lifetime of services, payments, and even habits and changes that you don't even consider as part of your data. Let's go to the next slide. This is what it is today. The reality is that your data is going to land somewhere, and somewhere is going to use it to either give you service, provide you with support in case of long-term, or even medication. But the real stakeholders are everyone, from the provider, the hospitals, the professionals that are providing you. Charities have a very big vested interest in the data. Associations like, healthcare associations, HEMA, for example, they need that for studies. Insurance company really keeps a good close eye on that data. Investors in the healthcare, universities, labs, local authorities, governments, and actually startups. Okay, I'm a CEO of another startup, that startup funding and incubation called the TNI, and this is what we look for: startups that need investment in healthcare sector. So the data today is everything that you do at home, at hospital, at a clinic, or even at your device, and that persona is tied up to a set of demographics, including your mobile phone number, your email. So that's how they can attach data. Let's go to the next slide. So here's a question: how did we arrive at this size of data gathering and data? In the story, the beginning, it was what we refer to as the paper file. And things was nice in the paper file. The paper file is only through physical access, which means if you don't hold the file, you don't hold the data. If one person or one doctor or one clinic has that data because you're visiting it, guess what? They're going to lose it the moment you move on and go to the next doctor. So the actual file gets driven forward. The next level that came after that is the data center within an organization, like one hospital. They have what they refer to as an EMR, and that's secured because it's on a local network access. There's no external access to it, and it's just used what we call an ad hoc network inside. The next stage was now you have multiple locations that need to talk to each other. Okay, so it allows you, the service provider, the insurance company, that to access that data, and now it became what we refer to as PHR, or actually, IPHR. So a PHR is a personal health record that includes anything related to your healthcare, and it can be accessed through the internet securely. So next slide, we'll talk about exactly that. A doctor carrying a file, so that's where he has access to. The next one would be just a facility or a campus, for example, a medical city. They only them have access. And the last one was the cloud file that is currently in place for multiple regions, where all the data is centralized through different databases across, and anyone with the right authorization can access that. Next slide, please. So how can I protect my data? The biggest challenge that people face every day is that for them, healthcare is something they don't want to deal with. It's a bad experience, and they don't think about it when it's over. Go back home, and we start on the internet, and guess what happens? Life is back to normal. The first thing you got to remember is whenever you access a healthcare facility, ask the right questions. You have all the right to know, why are you getting this information? Why do you care if I'm smoker or not smoker? Now I'm talking about the registration, for example. If the right person is asking the right question, then you should provide it. If not, then you should at least question. The second thing you need to do is stop using Google to search for things related to you, especially if you have a Google account and you logged into Google. It's all tied up together. And now the bottom line is anything you type in that search engine is getting collected and is considered part of your behavioral information to that persona. So Google itself could be a data breach if you put some more specifics than normal. I mean, some people go in there and they say, "This is I'm looking for the for something in psychotherapy," okay, and then they say the age 20, and then they mention the children. So all the stuff that you don't realize, it's actually getting gathered by artificial intelligence, data mining tools, and getting collected and tied up together to provide a cluster of data that's actually becoming a permanent part of your persona. Never ever allow copies of any financial means, because these images end up on all kinds of storages devices. If you need to use your credit card, use the credit card. PIN number or signature should suffice. Your KNET, definitely do not leave a copy of your KNET card. That's a no-no, unless they have a very good justification, and I don't know what that is, but do not let them make physical copies of the card itself. Another thing is, we fall into this all the time. Don't share any sensitive information, health or otherwise, when it's not necessary. Do not volunteer the information at a pharmacy, at a lab, and don't ask side questions that are not related to the case or the service that you're receiving, because you don't know where that piece of information is going to end up and where is it going to get stored. And it could one day pop up in your insurance claim that, oh, wait, at that day you had a visit at this clinic and they put in your as far as your notes that you have hypertension when you didn't really have hypertension. So it's very important that we don't share that data. Another thing you should look for is, does the clinic or the hospital have a self-service access? And the reason why you ask that is not just because you want to access your data. You want to know if they have a self-service portal, because that by itself explains to you that they are gathering information, keeping information, and it's accessible to the outside. And then ask if you can get a username and password to understand how hard is it for me as a patient to get access. And when you get the access, log in and see what information is available. And the only part that you can do about this is gives you an understanding of what type of data they have on your previous visits. Okay, on the EMR. There's still going to be some parts of the data that I'm going to share with you, but you will know two main things. They do have a portal and they do have an EMR, and shared with patients. The same thing when it comes to going to an external service. If they start asking you specific questions that are not necessarily needed, you can say no. The problem when you're at a hospital and the hospital is sending out one of your studies or your lab tests to a third party, you need to know what are they sharing with them, because they're supposed to send them specific information. The age, the gender, for example, what's the original complaint, so they know what this test is for. But they shouldn't be getting your civil ID. They should not be getting any photos of you. There's some specific information. So when you apply for a service, they mention to you that we're using an external lab, you should ask, what information are you sharing with this lab? And are they getting my data as far as a person? And of course, never ever have copies of anything related to your health, relative, people you care about on social media. That is one of the worst things you can ever do. Don't believe that you can delete. Keep in mind that this is critical images. And last point of the presentation, a lot of the people who lived in the US had a very embedded concept that HIPAA's here, and if the hospital or the provider is HIPAA compliant, he is going to be safe to deal with. However, outside of the geographic boundaries of HIPAA, none of those rules are enforceable, even if they have a HIPAA certified system. And thanks to Dana reminding me about that yesterday, that if you're outside of the States, remember, even if they're HIPAA trained, and even if they have a HIPAA certified system, HIPAA's rules are not actually applicable because the law doesn't apply to the geographic boundaries. And that's the end of my presentation, I think. Thank you.
Thank you, Leif.
Thank you.
And now,
Thank you so much for that, Leif. That was great. While you were talking, I was thinking about a project I did a few years ago for the European Bank for Induced Pluripotent Stem Cells. Quite a mouthful, that. But, you know, we had extensive discussions about how to get agreement from patients about the storing of their data and the importance of protecting their data, especially their DNA data, because a person can be identified by their DNA data, which is in their blood. So that's something for all of us to think about. Thank you so much, Leif. And I'd like to remind everybody that at the end of this mini conference, we'll be having small group discussions with the speakers. I've already seen a couple of questions for Leif. So you'll have the chance to go into a breakout room and ask him questions, have discussions with him about the wonderful presentation that he has provided for us. And now what I'm going to do is to talk for a few minutes about another healthcare related issue that overlaps to cybersecurity. One of the issues that we've had regarding safety and security in Kuwait is COVID-19. I'm sure we'll all agree that was quite a safety and security issue for us. Now, one of the issues is that we've had a lot of people doubting, some people even doubted that COVID-19 existed as a pandemic, and some people doubted that they talked about it was a conspiracy of some sort, and they doubted the efficacy of vaccines. So I'd like to talk just for a couple of minutes about how the COVID-19 vaccine came into existence. Some people feel that it happened so quickly that we were able to have vaccines about a year and a half, about a year after the emergence of the pandemic, and that convinced some people that this is planned in advance. So I'd like to talk about the clinical research and clinical trials process that really resulted in a vaccination which is saving tremendous numbers of lives. So on your screen right now is a high-level view of the clinical trials process, and this is from Britannica Encyclopedia. So you can see that the first step is discovery and development, and I'm going to talk a bit more about that in a minute because that's a very important phase that goes on all of the time. And next is the creation of a protocol for testing out and proving whether or not the discovered science can help people. Then there's a protocol review by a wide number of scientists involved. And then there's the actual clinical trials. There's a phase 1, phase 2, and phase 3. Each one includes more and more people to prove the efficacy and safety of the drug or vaccine. And then there's regulatory review and approval, which in US is by Federal Drug Administration, and it is their approval that is accepted in many countries around the world, including Kuwait. So Kuwait does not do the work that FDA does. the extensive federal drug and federal review of drugs and vaccinations and so on, but rather Kuwait accepts the review by other countries such as US and UK. And then a phase 4 would be to continue continue surveilling what is happening with the treatment, whether a drug or a vaccination or whatever it may be, to determine whether it is causing good results and health benefits or causing troubles. So let's look more specifically at the COVID-19 vaccine development. And I want to especially emphasize on the preclinical. There had been research going on for many, many years that related to COVID-19 because it's a coronavirus, and it's not the first coronavirus. You may remember previous outbreaks such as H1N1. And there's another one called MRSA, and there's been several very virulent outbreaks. And whenever the pharmaceuticals see these outbreaks, they, of course, try to develop treatments that will help human beings to deal with these diseases. So what we need to understand as to why several different vaccines were available fairly quickly is that this clinical research goes on all the time. And that's one reason for the expense of drugs such as vaccines, because the pharmaceuticals have to invest constantly into clinical research that in many cases never produces a useful treatment. They just have to keep trying and trying and trying. And I would like to end this very short discussion about this issue by mentioning more specifically how the most effective COVID-19 vaccine was developed. I'm showing you a picture of a woman who suffered many years, decades, because she had thought of a treatment which we now call messaging RNA. She was ridiculed as a scientist. She lost her employment. She lost her research funding, but she never gave up her idea that messaging RNA could be the answer for many diseases. Now her work is the foundation of the most effective COVID-19 vaccination. So this is an example of the kind of work that scientists engage in so that they can be there at the moment when we need them to bring us amazing medicines and treatments that have to go through years and years and years of development in basic research. And we have to keep in mind that many times a scientist will have an idea and it doesn't come to anything. It doesn't work out the way they hoped it would. She finally collaborated with a colleague who was from another discipline, the contagious disease discipline, and together they were able to write a paper in 2008 regarding how messaging RNA could be used as a vaccination treatment for serious virus diseases. Again, they found very little positive reaction. They were still continued to be ridiculed. And yet, when we came to some further coronavirus situations, people began to think maybe this would work. And so the science was ready, was maturing behind the scenes while before the disease actually broke out into a pandemic. So that's the actual reason why messaging RNA solution could be developed into a vaccination by several pharmaceuticals just at the moment when we needed it the most. So I hope that this short presentation will help people to understand that it wasn't magic that brought forth the effective vaccination just at the moment when we needed it. And it wasn't Bill Gates who infected the world and then somehow found the solution for what he had infected the world with, and so on and so on. I'm sure you've heard all the conspiracy theories, but rather our safety, our health safety, has been tremendously and wonderfully supported by the work of this woman who was tremendously disrespected, lost her job, rejected, but thank God for her. I'm sure we're all grateful to her that she continued the good work and was prepared to give her answer to the world and to other scientists who have then taken it and made it into a treatment, into a vaccine, which helps us to either not get COVID-19 or have a very mild case. And certainly the death rate has plummeted as a result of this vaccination. And now I think we'll be able to go on to our next presentation, our next subject, which, if I remember correctly, is the oil and gas sector. Am I on track, Paula?
That's correct. So the next presenter will be Colin.
Okay, you want to show your next slide? Okay, so Colin Brown is the former chair of the OSAC, of the Overseas Security Advisory Council, for several years. He's been involved for I guess about 10 years with the OSAC, and then he was sort of deputy chair and then chair of the organization. Yeah, and he's also the security management consultant for Saudi Chevron. Now, I've talked with Colin about his presentation, and frankly, I'm very excited to hear what he has to say. He's going to present with us some very useful ideas about the relationship between traditional security and cybersecurity. So welcome, Colin, and over to you.
Thank you very much. I think I've managed to unmute myself, so you should be able to hear me.
Yes.
We're going to look first at the first principles of cybersecurity and confidentiality, integrity, and availability. The confidentiality has been very, very well described in the medical sense. Everybody's personal medical data, the confidentiality of that. The integrity, making sure that the data is not interfered with, that it is correct, and its availability to the required users. Now, the cost to your medical insurance going up if somebody breaches your confidentiality, I think is as nothing in comparison to the loss of data from an oil and gas company. If you consider that the seismic data for a new field or a field that is under production, and they're trying to increase the yield, get the very last of that reservoir, that could be worth billions of dollars. So the cybersecurity of it, you've got to keep it confidential. You've got to make sure that the right people have the right access. The integrity, the correct data, get it wrong, you're spending hundreds of millions on an exploration project. You've got your data wrong, it could be an absolute disaster, and it could bankrupt smaller companies. And then the availability. Who has it? who has access to it, who can change the data, who can enter the data, etc. The usual cyber principles have to be considered. Now let's compare those with the physical security principles. Deter, detect, delay, respond, and then lots of people will sort of shout recover. Now, what is the purpose of deterrence? Deterrence is to make yourself look harder to break into than your neighbor. So it can be from the way that an individual walks down the road. Are they going to be a victim of crime, or is the opportunist going to wait for somebody else? Detection. How do you know when you are under threat? How do you know when an attack is taking place? The delay. How long do you need to delay? The response, and then the recovery. So the first principles in cybersecurity and in physical security, these are the accepted first principles from ISC squared, and then in physical security from a multitude of different people. Not one of those is based on risk. Everybody says, oh yeah, we do risk-based planning, we do risk-based this, we do risk-based that. There is nothing in the first principles of cybersecurity or of physical security about risk. Now we know that the first step in ISC squared's program, for the CIS program, is the risk analysis. In the principles, there is nothing in it. So I want to propose something, if I can. And this is a joint principles of select, protect, and detect. What does this mean? Selection, protection, detection. What are you securing? So physically, you would have your asset register. You would have your list of buildings, you would have your list of key people, of key systems, key equipment, everything else, and you would do a full inventory of what are you securing. And then you're doing from what. Now, the interesting thing is for security in comparison to, say, fire or other health and safety related issues, is that a fire in Australia, Austria, Azerbaijan, or America will act exactly the same way. If the room is the same and the contents of the room are the same, the fire will act in the same way. And so you can have a science of firefighting. In terms of security, every single person will react differently to a situation, whether they are an attacker or whether they are a defender. But in physical security, you have to have a geographic co-location. You have to be in the same place. So I can't, if I were to be a robber, I can't steal a watch from a Rolex shop unless I am in that Rolex shop. For cyber, you can. So we're going to go on and talk a little bit later about AramCo. Now, just to give you set the sights for it, the cutting sword of justice who carried out the 2012 attack in AramCo, nobody knows who they are. They've never been tracked down. Nobody knows where they were, and they did not have to be geographically co-located. So in the physical side, what are you protecting yourself from? There has to be a geographic co-location. On the cyber side, there does not need to be a geographic co-location. And also, you can't say that, for example, an American oil company will have a certain type of threat actor. So from the FBI counterterrorism, they would be able to say this company is more likely to be attacked than that company because it's associated with the United States, with its association with the energy industry, and so forth. Any company can be attacked remotely by a cyber attack or a logical attack from anywhere in the world if they have access. Now, I'm going to emphasize the if they have access because we're going to go on and talk later about the industrial and Internet of Things. Also, what are you securing from what and why are you securing it? If you say, I'm securing everything from everything, you are going to end up spending a gargantuan amount of money on the physical security safeguards and on the cybersecurity safeguards. But you also have to select who is allowed access. This is not just in terms of physically, who is physically allowed into your facility, who has the physical access to your server room, who has physical access to your network, who has physical access to your data. Now, your data might not actually be stored electronically. It might be drawings for a construction plant, for example. The library of documentation at the end of a construction project, a major construction project, will be several 40-foot containers of hard printed documents, all signed off, which are kept for legal reasons. If you're going to conduct an insurance fraud as part of a construction project, you burn the documentation. That's just a little hint to you. If you ever get in trouble, burn the documentation, because then you have no guarantee that the changes that are documented electronically were actually made, unless you have the paper physical evidence. But who is allowed access? The greatest cyber thief is Edward Snowden, that we know of. He was allowed access to NSA databases that he had no right to see. Who is allowed access? Is a contractor who makes himself very, very useful because he's very good at his job. Should he be allowed access to the highest level of secret intelligence? The answer is no. Should I have access in my client operation? Should I have access to their seismic data? No, I shouldn't, and so I don't. So it's who is allowed access. It'd be interesting to find out how many companies represented by people attending this conference actually do carry out due diligence on a new hire. People will say, I can provide you references on request. Now, I'm not going to provide you a reference to somebody who thought I was an idiot. I'm going to provide you a reference to somebody who I thought was good, or I'm going to prime somebody to pretend to be that reference so that they can vouch for me, so I can get into your organization. Who is carrying out correct due diligence? In 2006, I carried out a security risk assessment of an Icelandic bank, which is based in London. This was before the financial crisis, and Icelandic banks were holding more on deposit than the entirety of Iceland owed. And they had a newly joined executive assistant. And I said, has anybody checked on their background? And they went, no, she's just the executive assistant. She had access to everything because the position is executive assistant to the chief executive officer. Nobody had checked her out. When we did a background check on her, it proved that she was who she said she was, that she was as good as she said she was. But it's much better to do your due diligence first. So you do risk-based planning. And I guarantee just about every single person here has heard somebody saying, we do risk-based planning, and then they just pick up a template and put it down. And that's what their version of risk-based planning is. They do not consider what they're securing. They don't consider what the threat is. They don't consider why they're doing it. And they don't consider who is having access to it. So once you've done your risk-based planning, you then need to look at your safeguards. You need to look at your protection. So you've got physical safeguards and you've got technological safeguards or logical safeguards. Let's say you've got a firewall. A firewall is, in physical terms, it's a perimeter fence. You've got password, you've got two-factor authentication, you've got multi-factor authentication, you've got biometrics. That's your access control, that's your gate, that's your door, that's your guard checking your ID, etc. Do you want to protect everything the same? Do you want to protect your personal data to the same level as your special personal data? Does it matter if people know that I drive a white car? No. Does it matter if they know what model of car it is? Not really. Does it matter if they know what the vehicle registration number is? Yes, it does. So even for a car, you have got different levels of information and what you need to protect. Now you can design a physical entry system, and you can say, at this moment in time, the biggest threat to this organization is a vehicle-borne improvised explosive device. Therefore, I need to have standoff, I need to have road blockers, I need to have this, I need to have traffic calming measures, I need to have that, and you can start making a shopping list a mile long for your main entrance. You can then say, I need to have blast film, I need to have a safe haven, I need to have this, I need to have this for your next layer of physical security. What happens if the risk changes? For physical security, you need to carry out a very, very large expenditure to make your safeguards meet the next risk. If the risk changes to what was called the storming attack of the individual with a suicide vest and automatic weapons. If your gate is to prevent vehicle-borne improvised explosive devices, you might not be in the position to stop somebody on foot. So you need to change it. Luckily, in logical security, there is greater flexibility if the logical and cybersecurity element have got the ear of the decision maker and they have got sufficient budget to carry it out. Now, how long do you need to protect something for? This is the delay in the physical security sphere. If you think about it, how long do you need to delay? It's the same. If you think you've got to keep somebody safe from fire, so you put in a 30-minute fire door. That means within 30 minutes, these people on the other side have to be rescued. In terms of security, if your nearest response is 2 hours away, you need to be able to have a 2-hour delay, so that the attacker cannot get to you for 2 hours. If your nearest response is 5 minutes away, do you necessarily want to have just a 5-minute delay? No, because if you look at the recent school shooting in Texas, the police got on the scene within 5 minutes, and it took them many times longer than that to actually affect the entrance into the classroom. In terms of your password, if you have a 4-digit or 4-figure alphanumeric password, that can be broken in, I think it's now down to 0.05, 0.1 seconds. If you have a multi-length password using special characters and upper, lowercase numbers, etc., and you make it a complex one, I hope, like everybody is now using, it takes longer to break into that. So for how long are you trying to delay people? If your system and the behavior of your employees and contractors is so good that an attacker finds it difficult to get in, both physically and logically, it is probable that that attacker will go elsewhere. Not guaranteed, but it is probable that they will go elsewhere. And has the situation changed? As I said, has it changed from a vehicle-borne IED to an individual carrying out a storming attack? So those are the select and the protect, and now the detect. In 2010, a client said to me, at least now we know when we're being attacked. And I was interesting. He said, yeah, 5 years ago, we wouldn't even know we were being attacked. I said, that's very, very interesting. Yeah. So how do you do that? And he said, well, because of the following behaviors that we would see on the system. In 2012, it turned out that in 2010, whilst he was very proudly telling me that they could tell when they were under attack, they were under attack and they didn't know. So what are you going to detect? You must be up to date with what the threat is. So has it changed from vehicle borne to a storming attack? Has it changed from an Extinction Rebellion kind of organization, a militant environmental group? Is it an organization such as Trident Plowshares, where you get tied up in a periphery against their anti-nuclear protests? What are you going to detect? If you don't know what you are going to detect, you might not have the right systems in place. Now, a zero-day attack in the logical world is new. By its very nature, it is the first day that has been used is the 0 day. Knowledge of that attack vector has not been recognized before. So you want to make sure that if there is an attack, you get yourself patched and you get yourself up to date. In 2008, there was an organization called the Peninsula Lions who decided that they were going to try to plan an attack on Camp AmCham. Luckily, they were infiltrated, but the Lions of the Peninsula had never carried out an attack before. They were a new group. Unfortunately, for them, unfortunately for everybody else, their operational security, their OPSEC was so bad that they were infiltrated and they were taken down. But then what's happened in June 2015 at the Imam al-Sadiq Mosque in the city? You had a Saudi with no record with the Ministry of Interior in Saudi Arabia, flying from Bahrain, where he'd crossed the causeway into Bahrain, flying from Bahrain to Kuwait, no flags raised. There was no reason for any flags to be raised. And he was then equipped with a suicide vest that had been driven across the border from Saudi Arabia in a vehicle that was designed not to draw attention to anybody. It was a 3 or 4 year old Yukon. It looked like every other vehicle coming across, and the suicide belt was hidden in an igloo cool box underneath soft drinks. This was not an attack that really could have been intercepted. The operational security on this attack was absolutely fantastic. But suicide vests have been used in Saudi Arabia, Iraq, and elsewhere. If the correct equipment had been put in on either side of the border, it is possible, not probable, but it is possible that that attack could have been interdicted and prevented if this correct surveillance apparatus had been in place. So how are you going to detect it? Do you have the right tools in place? You could be using an obsolete system that just cannot detect the what is going on now. If you're looking at a surveillance system, a physical surveillance system, which is covering an industrial area, perhaps you want to make sure that you have other methods of detection other than just ordinary CCTV cameras, data cameras. Because then you give value added to what you are doing, because you are able to detect industrial anomalies, not just intruders, but actual process breakdown. Also, where do you want to do it from? A lot of people will say, I've got CCTV, and where is it observed? Where is it monitored? From my manager's office. And the manager likes to have a screen in his office which has got all the CCTV cameras, and he's in a meeting or he's working. He's not looking at it, or she's not looking at it. You have to have somewhere where you can observe your surveillance. Do you have any questions so far? This is what I'm presenting as select, protect, and detect. And you can see, I hope, that there is some correlation across physical and cyber security. Are there any questions so far?
It's really good, Colin. And actually, at the end of the whole mini conference, we're going to have breakout rooms so people will be able to join with you and ask questions and discuss with you.
Lovely. Okay. So I'm going to move on to this. I mentioned earlier that humans get involved in security situations. 95% of all cyber incidents occur due to human error. This is not me plucking it out of the air. This was in June 2022, the World Economic Forum and IBM published this figure. 43% of breaches have been attributed to insider threats. Let's go back to that point I made about due diligence. Do you actually know who you are hiring? Every single major robbery in the UK has involved somebody who was either actively or previously in the security of the organization being robbed. The Brinks-Mat robbery, the Hatton Garden robbery, all of these have involved people who had inside knowledge of the physical security measures of the organization being attacked. And in cyber, it's 95% of all incidents are due to human error and 43% attributed to insider threats. Said quis custodiet ipsos custodes. Who guards the guards? Who watches the watchman? Edward Snowden, he was a cybersecurity expert. The guard at the Brinks-Mat robbery, he was the man with expertise in the intruder detection systems and the locks at that facility. Who is guarding those who guard? Goes back to where you're monitoring it from. If you have a surveillance system and it's in the manager's office and he's just there because, can I use the expression, he wants to show he's the big swinging dick and he's the guy in charge so he can observe what is going on. He's not going to do that. It's not what he's paid for. If you have a crisis, how do you detect it? If you have an operations center, what are they monitoring? Who is monitoring what is going on? Are they part of the 43% insider threat, or are they part of the 95% human error? So let's look. I mentioned earlier Shamoon and Aramco. The cutting sword of justice claimed responsibility during Ramadan in 2012 for an attack that destroyed 30 to 35,000 computers in the Aramco network. How did that attack occur? Now, let's give it a background. All of the computers that were destroyed were in organizations that were involved with the sale and marketing of oil, HR, accounting, ordinary functions. In other words, they were networked systems that were connected to the internet. This wasn't some super duper war games child in a bedroom hacking his way into a system. This was an IT administrator clicking on a link in a spam email. The guy who should have known better decided that he would click on that link during Ramadan when hardly anybody was in the office, and it immediately began to infect 30 to 35,000 computers, plus the servers, etc., etc. Now, it took 5 months for Aramco to come fully back online, and in the meantime, they were given diesel and petrol free in the Kingdom of Saudi Arabia because they had no way of selling it and recovering the money. So after 17 days, they started giving it away for free. They went back to using typewriters and fax machines. And if you have ever seen an oil and gas contract, which would fill 2 or 3 house moving boxes, thousands of pages, you can imagine faxing one of those through. Also, you can imagine taking that contract and moving it by hand in ye olde fashioned way around the offices by internal post and getting it signed off. That was very much more secure in that it wasn't networked. By God, it was a very, very inefficient way of doing business. But at the same time, the systems that were not networked carried on working. So oil production carried on. The shipping of oil carried on. Tankers were coming into Ras Tanura and into Yambu, and they were filling up and they were shipping oil. If you bought a computer or a hard disk from October 2012 through to March 2013, you were no longer at the front of the queue, because Aramco barged to the front of every single manufacturer's queue and said, we are first. And I don't care if you are Dell, I don't care if you're Lenovo, I don't care if you are the US government, we are first and we will buy everything first. So the price of your hard disk or your computer went up during that period because of supply problems caused by this hack. But the industrial Internet of Things, the non-networked items. The industrial Internet of Things means things like SCADA systems or SCADA. I got told off the other day for pronouncing it SCADA because I'm British, and I was being told I should pronounce it SCADA, and then the next person speaking called it SCADA. So I'm not the authority in how to pronounce it. However, an industrial Internet of Things. We talk about the Internet of Things, about how our house is networked. And we say that, oh, look, our industrial network, Internet of Things, is air-gapped. It is secure, and that leads to complacency and vulnerability. Because if it is air-gapped, how do you attack an air-gapped system? We've just mentioned Shamoon, which was for the networked system. But what about Stuxnet? Stuxnet attacked the Iranian nuclear facilities on a completely air-gapped system in a country where internet access is very, very difficult. You've got a difficult to attack internet system, and you have got a completely air-gapped system in the most sensitive, most secret parts of the Islamic Republic. Somebody had to carry the attack vector. For Stuxnet, it was a thumb drive. Because everybody expected the system to be absolutely secure, they became complacent. And because they became complacent, they became vulnerable. Companies and organizations that are complacent with their physical security are also vulnerable. Now, if you are complacent with your physical and your logical security at the same time, and you are not searching for the thumb drive, and by this, you don't necessarily mean an entire thumb drive with the case and everything else. It was a very, very small payload, so you need a very small chip attached to a USB so that you can put it into the system. With Stuxnet, we will never know what monitoring they had in place, and we will never know at what stage they discovered it, and we'll never really know how effective Stuxnet was in that initial attack. But what we do know is that Stuxnet, when it has been reverse engineered and used against the West, has been very, very successful. A very small payload, remotely, in some cases remotely delivered, in other cases physically delivered. But if your physical measures of security had been good enough in your detect phase, then you would have found that vector before it could have been introduced to the system. What is the human impact for a failure in the industrial Internet of Things? If your health records are stolen, your insurance premiums go up. That's horrible. It's really difficult, particularly if you are suffering from a serious illness. However, in the industrial Internet of Things, if there is a failure on the scale of Bhopal, you are looking at thousands of people killed. You consider the difference, say, between Nigeria National Petroleum Corporation, where almost everything is conducted manually, and Aramco, where they have a small number of control rooms throughout the kingdom, and they are controlling the production, shipment, and supply of oil throughout the kingdom. remotely, if you are able to attack that and blind the monitoring station to what you are doing, the environmental impact could be utterly disastrous. The human impact could be utterly disastrous. Also, the industrial Internet of Things, requires you to have remote sensors for all your telemetry. If you can find a sensor and you can attack that sensor, you therefore have access to a network. It might not be networked in the same way as the internet, but you have access to the industrial Internet of Things. There are 5 companies in the world currently providing industrial Internet of Things security. 5. If you are using any of those, or you're using any IIoT system, and you hear of a competitor who is operating the same system who has been attacked, you must act as if this is a crisis, and you must bring your crisis management team into action, and you must check twice over that you are not under attack. Wide dispersal of sensors also means that you have a data management and possibly a GDPR issue. If you have Nord Stream 1 and Nord Stream 2, you have sensors that are going from Russia to Germany through national waterways, and those could be intercepted relatively easily in order to get the data that is being passed along that pipeline. The other one is interoperability. If you have installed a telemetry system on a 40-year-old refinery, you have the interoperability problem of a very modern logical system and a very old physical system. So you have all of these issues of how does it work? If there is any form of weakness, how can it be breached? What can you do to prevent it being breached? And given that you only have 5 types of security tool to use to protect you logically, I would suggest in this instance that your physical security becomes even more important, so that you are able to carry on working in the method and the style to which you have become accustomed. So I do hope that this has been useful. It is trying to explain the concerns that you cannot regard it as simply a cybersecurity issue or simply as a physical security issue. You have to look at it as a joint problem, that there is overlap with the cybersecurity or logical security, and there is overlap with the physical security. As Dana said, there will be the breakout room at the end. I would be delighted to field any questions, and I'd be even more delighted if people would challenge anything I've said so that I can learn from them.
That's great, Colin. Thank you so much. That was fantastic. And what's really, I think, important about this presentation is that people who are not from a technical background can see and understand how to manage the cybersecurity problems and cybersecurity issues and processes from a non-technical perspective of security management. That's really great. And now I'd like to hand over to Paula to introduce our next speaker.
Thank you, Dana, and thank you so much, Colin. All right, so our next speaker is Richard Artdeacon. So Richard is Cisco Security Advisory CISO for the EMEAR region. So Richard was previously a chief technologist in Hewlett-Packard Enterprise Security Practice, working with clients across all industries and regions. Prior to that, Richard worked for Symantec for many years. He has also held posts with security industry organizations such as IAAC and the IISP, and has worked on cyber resilience reports with the World Economic Forum. Richard, the floor is yours.
Thank you very much, and thank you for this opportunity to talk with you. I believe that you should have a slide deck, which you could, if you could bring that up now. Thank you. Well, it's going to be difficult to follow on the previous talk, so thank you for that, Colin. I think you brought up a number of different themes, which I might touch on here. In my role, I spend a lot of time speaking to chief information security officers in all sorts of different countries and industries. And part of my role is to look at the strategy that they're following and try and understand that. I come from a background of doing big security transformations. So I also like to think what is practical in the real world. The topic I was asked to talk about was something called zero trust, which is a buzzword that is around and which is spoken about a lot. And I want to put that into context. If we could just go on to the agenda slide. What I'd like to talk about is what I think CISOs are thinking about at the moment and present some research on that, then talk about this concept, how do we get there, and then look at some of the benefits that might accrue from that. So if we could just go on to the next slide, I'd like to talk now about what CISOs are thinking about. What are the issues they have and what's beginning to impact on them, especially within the industry that we're talking about. If we have a look at this, I'm also referring to the forum. As said in the introduction, I helped on reports for the forum, so I tend to go back to them to have a look and see what's happening globally. And so what I was looking at now is what are the drivers that are impacting on security and how are they impacting and how they related to what our business colleagues are thinking. And I thought it was quite interesting that this has just come out, this report, very recent. And for a long time, we've been talking about remote working, but that now seems to have gone down the scale. I think it's almost seen as if it's been done. But the two big areas are around digital transformation and third-party software attacks. And so we have, through digital transformation, more disruption to the organization, which of course becomes an issue for security because we have to know how to secure that disruption, secure that change, and enable that change. And of course, we're worried now more and more about third-party software attacks. And I think the two are joined because we will work a lot more with third parties, a lot more with software from third parties as we drive digital transformation. So the two are probably fairly closely related. I was reading a very interesting article, which has just literally been published by McKinsey the last few weeks about the oil and gas industry, where you're having this drive for IoT, the Internet of Things, and other high-tech digital transformation. And I think that's already been discussed, some of the issues around IoT. But their argument was that this is going to drive the oil and gas industry because it can actually bring in a financial advantage. And they tried to give a figure of the equivalent of about $5 on every barrel of oil for upstream activities and $1 on every barrel of oil for downstream activities. What this means is there will be a financial element to digital transformation, and that will drive it more, and that will make CEOs and CFOs and CIOs look at digital transformation. So from the CISO, from the security point of view, we've got to understand the business cases around the change and make sure we embed our security change right from the very beginning. In fact, one of the heads of security for one of the big oil majors has gone to the extent of putting some of their team onto the transformation teams, the new innovation teams, in order to try and identify the security change that will be required as the new digital change goes ahead. So just one observation is we'll have to make sure that we get at the cutting edge of innovation and put our team members in there in order to make sure that they can identify change and get security built in first. And as we all know, security built in second is the most expensive security of all. Getting it built in right in the beginning is extremely important. And I learned that lesson when I was advising a bank some years ago. They didn't do it, and it wrecked the bank. So it's something that we have to do right at the very beginning. And of course, we have a lot of regulatory issues that we have to keep ourselves aware of. So I just thought I'd bring that up as what are CISOs thinking about and what should we be worried coming down. down the line. So we go on to the next slide. One of the elements we know is that, and I think this has been touched on already, is that the standard perimeter that we're used to in security is gone. It's broken completely. Not a new idea. There was a forum looking at this over 20 years ago in the UK, and it drew on other heads of security from other organizations such as Boeing were involved. And it came up with the term deperimeterization, the end of the perimeter, and how did we create an environment of trust from our users and from our assets. So that idea of understanding who is accessing what has been around for some time. I think it's just matured and has now become mainstream, so to speak. But the expression that was used then was ignore context at your peril. So that has now become part of what we think about when there's an access to a resource. We must understand where that's coming from and who is leading that. One of the CISOs I knew at that time said the security was quite easy. All you had to do was just make sure that only the right person accessed the right asset. But as we know, there's a few little things in between that make it so hard. And I think Colin came out with those statistics about insider threat and how individuals are the breach. So the perimeter is broken, and if we look at what digital transformation will do, it's going to break it even further. So we have to look at an approach which is far more flexible, which supports our business colleagues, aligns with their innovation and their business cases. We could go on to the next slide. I just thinking about how this impacts on oil and industry and gas industry. I remember years ago working with CISOs, and we would create these network bubbles around the main assets. And we would create an environment where we could protect an asset so that, for example, a rig would still keep going or a pumping station would still keep pumping. So we created little islands. We were starting on the process of segmenting the network and making sure that we could limit the impact of any attack. As the CISO said to me, look, if the CEO's email goes down, that's embarrassing. But if a pumping station goes down, that's me losing my job. So that was the emphasis that was put on that. So what we built up is some very sound network type environments where we start to bring in some security controls across the environment. But again, we now have a world where people are going to want remote access to those controlling mechanisms, to those devices, and for good reason as well, and make maintenance and that kind of activity a lot easier. Not only in this industry, but in other industries as well. I was working with an Italian manufacturer, so they made control systems for manufacturing plants, and they were trying to do exactly the same thing. Why? Because it made their life easier, and it made it much simpler for them to maintain their assets and maintain the activity of their clients. So we build these bubbles, but we're going to have people going in and out. And so the perimeter to an extent is being broken because we have to let people in and out. So if we could go on to the next slide. Now this is I do apologize for this. This is a bit of a test of the eye chart. So I'm not going to go into detail, but I'll just try and explain why I think this is significant. This was some research we did. We had done independently by an organization called Scientia. And they interviewed somewhere in the region of 5,100 security leaders around the world. So it's a big global study, and they managed to get leaders from all over the world to look at this. And what they were asked to do was look at the outcomes of what they're trying to do from security programs. That's on the left-hand column. So you've got things like keeping up with the business, gaining executive confidence, against security practices, which is at the bottom. And now this was a double-blind study, so they didn't know who was asking the question, and we didn't know who was asked. So it does have some real sound validity in the answers coming back. And then what the data analysts did was they correlated the two sets of answers to try and work out what practice would have the best marginal impact to achieve an outcome. And the darker the blue square, the more impact that it would have. So this is what CISOs were thinking about going forward. What should we be doing to get the greatest impact? Now, you may agree or disagree with this, but this is a peer study, and this is what your peers are thinking. And the top 5 were started looking at around technology. How do you refresh it and how do you get it integrated? Because that's an overhead of time and it slows you down. Not surprisingly, we had incident response and disaster recovery in there as well, getting your teams in place, being able to recover quickly. And of course, accurate threat detection. So knowing what's coming through, being able to react with this integrated technology. And then if the attack gets through, how do you recover from that? So those were the top 5 issues that that they thought improvement in that area would have the greatest impact. Now, for many people, of course, they would say, no, I disagree with that. But I think that's just part of the debate. And this is part of us thinking about what we should be doing as our strategies going forward. So we're in a world where we have this drive for digital transformation, which is going to be pressurizing us. There's concern about third parties, our perimeter going. And those ways of protecting a network bubbles in segmenting ways is going to need to be enhanced as well. Still maintained, still continued, but we have to enhance as we look around and see how attacks are going through, going back to the previous speakers' figures on where breaches were coming from. So this is some of the general thinking. And incidentally, if you want this report, you can download it and you can have a look at some of the analysis, and it has regional analysis and so forth. But for me, this was very interesting. I hadn't seen this kind of report before. So that's what I'm talking to CISOs about. Now, if we go forward to the next slide, I want to talk a little bit about the zero trust idea. And of course, as I was saying, it's been around for some time, but it's just matured and become part of what we talk about. So if we go on to the next slide, one of the questions I get asked is this all nonsense? Is this just hype? Is this something that the vendors are thinking up to sell new stuff? And I think that's a perfectly legitimate question to ask, because that does happen in this industry and we have to be aware of that. Is this something that only big companies can do, or is it something only fintech companies, just starting from brand new, can do? And can it be done at all? So how do we answer those questions? And when it comes to can we do it at all, I've been discussing this with CISOs recently, and there were sort of 3 main themes which I think we should think about. One is, how do you build the business case for any transformation? Secondly, how do you manage the people aspect? Because that becomes an issue. And then finally, how do you actually implement this as a program? Do you do a big bang approach, or do you do it step by step? And those are the 3 areas that I think most CISOs are battling about. If we go on to the next slide, we'll start with basics and try and work out what we think it means. And I think it goes back to some of the previous comments about validating who somebody is through MFA and biometrics, but that's just the start. But the basic principles are, you don't assume trust, you always verify, and you enforce least privilege. So what you're doing is taking a risk-based approach, and you're then demanding verification, and then you're limiting what, for example, a user or a device can access, or an application. So in terms of not assuming trust, it means we have to, I always describe it as building from the inside out. So we have to look at an asset, a resource. It might be, say, an application. We have to understand the risk of that. And we then have to decide what level of trust we have to build. And once we decide on that, we will then go through how we verify who has access, or what has access to the data or that resource, and then limit that privilege to the absolute minimum. And so what does this do? This helps us ensure we know who's coming in. We understand the context, for example, and by enforcing these privileged and in fact segmenting effectively what access is allowed, we start to limit the potential for lateral movement. If, for example, we have an environment where people log into a VPN, they go into the VPN, then they can access everything. I think some examples were brought up. Then you're having increased risk. But if we just direct people from one point, say through a reverse proxy, to a particular asset, and that's all they can get, we validated who they are, so we reduce the risk of it being a false access, and we've reduced the access area that they can get to. So we're reducing the risk of lateral movement. And as we know from past history, and if any of you worked on Cloud Hopper or anything like that, lateral movement is just an absolute nightmare. for any CISO, because it just disappears in your environment and you don't know when they're going to pop up again. So when I think about this, I go back to my own experiences years ago, working on a breach about 6-7 years ago. And it was a third party who had been finance system outsourced, and they had a breach of compromised credentials. And so the attacker got in and was putting out perfectly legitimate invoices with different bank account details. A classic one, I think we'll be aware of. So what would if we had been able to stop the attacker and validate them, then we would have been able to stop the attack. And the attack was coming in from a different country at 2 a.m. in the morning on an unmanaged device. So putting in 3 controls like that, you can only access this from within the network between 9 to 5 and a managed device. We could have prevented the attack. So that, to me, is how this helps us in those principles. If we could go on to the next slide. It's not just simply a set of principles, and it's not simply a product. You can't go out and buy a couple of kilograms of zero trust. You've actually got to build it. And it's like any transformation program, principles, you have to have a strategy which aligns with your business strategy, then decide what your platform is. And I go back to that point about integrated technologies and technology refresh. And I'm finding a lot of CISOs are using this as a program to update a lot of their security technologies, bringing them in on a platform basis so that they don't have multiple different technology they've got to manage, they can control them. Make sure you have the capabilities of what you need to do as well. So take it as a programmatic approach. If we go on to the next slide, what we're trying to do to simplify it is put it into these steps: establish trust, enforce that access, have constant monitoring. So if there's a change or you require step-up authentication, you implement it, and then respond using IR capabilities, and wrapping that around with a monitoring system which will look at across signals from all of those areas and then orchestrate actions based on those signals. So what we're trying to do is make sure we know who, what, why, and when, and what if something goes wrong, how do you react quickly? And how do you pick up a signal on one particular laptop, one particular device? And how do you then make sure that you check it across the whole environment? How do you speed that up? And we build it across, or we take the approach of building across the user and the device, the network, and the cloud, where you're going to store your assets, and the application and data security. We have to manage both new cloud applications and drive to the cloud because of digital transformations happening, but what about your legacy applications? You still have to protect them within the network. So building those wrappers around the organization by establishing trust based on the risk level of the asset, making sure you're enforcing and monitoring those trust-based levels, then constantly monitoring during the access or the activity, and then responding to a change. So those are, we think, are the core elements that you have to try and put within any program. So how do we get there? If I just go on to the next slide, part of our study as well was looking at maturity levels, and I've highlighted utilities and energy. This is at a very high level, and we can see that telecommunications and financial services tend to be pretty high. Software development you'd expect to be. We're not quite sure why, but I think finance and telcos tend to be pretty heavily regulated, and that could be a driver as well. But it just shows that there's quite a way to go for how we go on this journey. Is it possible? If we go on to the next slide, I'd just like to share our experience, because we have to do what we say, what we think is a good idea. So if we go on to the next slide. We actually did this to ourselves in order to make sure that users can only access the right applications in the right way. And we rolled it out to about 100,000 users in 5 months. So it can be done. It does take a lot of planning and a lot of effort. I think the statistic that jumps out at me, and for anybody who's done big transformations, is that less than 1% of users contacted the help desk. And I think that that's a really great metric to have in place. So it can be done, and we've done it. And if you go on to the next slide, what were the core elements that made it possible? And these, if you've ever run a transformation, make it absolutely, these are the standard requirements. Getting executive sponsorship, having that right steering committee in place. I tend to use a Prince2 type format, making sure that you've got the right escalation paths for the program manager, making sure you've got the right project office to measure everything. Building teams across the organization, so breaking down silos between your security teams, your networking teams, your HR teams, your IAM teams, your help desk teams. Communication programs, really important, always are on transformations. But because we're, in many instances, we're driving the decision down to the user. For example, I must now authenticate this. I am now making a security decision. I am worried that some of my personal information might be going from my device. We have to allay all of those fears and make sure that they understand exactly what's going on. So communication across users is absolutely crucial. And what we did, which I thought was quite interesting, and this might be something that we can review in any organization, is how you build demand by showing people how it works. And then the business owners of applications come to you and say, can you actually help put my application behind the SSO or whatever it is, so that people don't have to log in so often? So it makes my users' life easier. I think that that's one of the great drivers around Zero Trust. If we do it well, is that we combine greater security with a better user experience, because we're enabling a far higher level of security, a far better level of risk. So I think the user element becomes important through the communication, and then you can try and create the demand for it. So those were really, I think, what were the key assets. So if we just go on to the benefits, I'll go through this fairly quickly. What is, we've tried to relate all of that research I said before against some the state of maturity of Zero Trust. And you can see as it matures, it starts to drive benefits around effective cost management, retaining your security talent, helping with your incident response processes. So it actually brings in a whole series of benefits that we've got to look at when we start to put on our KPIs. And if we go down to the next slide, one of the other aspects that I think are important is in terms of security resilience, and that's now become a big issue. It will give us the flexibility to respond to threats and then also change the business quickly. So for example, I'm going to go back to users. If we have a structure in place where we have the ability to ensure that users need to be monitored the whole time, they have to go through particular risk profiles, and they have to be able to confirm who they are. We have to know what their devices are. We can start to move new users in fairly easy into a secure environment. So we can start to check who they are and check their behavior. And so if our business changes through taking another contract or bringing more contractors or through a merger and acquisition or divestment, enables us to flex our security a lot quickly. As one of my colleagues said, it means that instead of saying, oh, there's a security issue, how are we going to handle new users? I say, when would you like that done? Will tomorrow morning be all right? So that's the kind of benefit we've got to look at. So we just got to the final summary slide. It's a change. Understand the change in the business and build your strategy around that. So that's around the business case issue, which I mentioned earlier. Remember, it's about the people side as well. And we're going to be changing how people think about security. And then when you start to implement it, take a programmatic approach, go in steps, go in stages, and make sure you start to build it into the organization. And remember, it's going to take time. Many CISOs I know say it's going to take us 2 to 3 years in order to implement this change. So it's the business case issue, and how do you get executive sponsorship? How do we deal with the people that we're working with, the users, and also our colleagues in the business and security? How do we communicate with them? And finally, how do we implement it? How do we break it into digestible chunks in order to make sure we can this journey goes successfully? So that is the final slide. So thank you very much.
Thank you so much, Richard. That was superb, and I think such a great follow-up to Colin's presentation. It seems we've been having the British hour between you and Colin, and we really appreciate it. That was, and I especially enjoyed your zero trust skepticism slide, and acknowledging that there, some of us old-time IT people with many, many years of cybersecurity. We've seen many concepts come and go, and plenty of marketing slogans and buzzwords. So yeah, I'm very glad you brought that up, and I agree with you. It's been around a long time, and it's a good idea. Zero trust is what good IT people have been doing for quite some years. and we should be doing it now. So thanks very, very much for your presentation. And now for our final presentation, I would like to introduce my colleague, Senthil Kumar, who's the Managing Director of IT Consulting with Productivity here in Kuwait. And he's also on the board of directors with the ISC² as the treasurer. So I'm very grateful to him for his support for ISC² in Kuwait. Thank you so much, Senthil, for being here with us today. Senthil, over to you. The microphone is yours.
Thank you, Dana. I will probably start presenting my presentations. Give me a minute.
Yes, you can.
Okay. I'm here. Thank you, Dana. And it's quite interesting. And on behalf of ISC² Kuwait chapter, I really appreciate all the previous speakers in their presentations. Pretty good. Well, there are lots of good messages. Our Kuwait members and Kuwait chapter members take it to a three, right from the healthcare to an oil sector. Okay, before I getting in, I think let me also provide some sort of introduction about me. I've been there in Kuwait for the last 20 years and doing a lot of consulting projects for oil companies, healthcare, and the banking sector. In today's presentations, I'll be talking largely about two concepts which can be applied across those specific industries. It is an overall architecture, overall methodology. It's not specific to one industry only. It is generally used it across in the organization and industry. So I'm going to talk about two different concepts today, and probably and how this is going to be effectively providing some kind of message to all of you people. I'm very confident because I implemented or advised my clients using these methodologies. First one, we're talking about integrating cybersecurity with enterprise risk management. I'll be talking around for 10 minutes time. Thereafter, I'll be moving into something called cybersecurity workforce framework. It's really both particular presentations. I'm taking assistance from NIST standard publications, which provides a fantastic structure for these two agenda items. And I'm going to talk about one by one. Right, okay. So I don't know how many of you would have had a very structured organization where the risk departments handles many of the risk in the enterprise, right? At least in the banking sector, where I predominantly work or consult, as a very larger, well-structured, well-organized, well-governed enterprise risk management department works. And that enterprise risk management department handles categories of multiple categories of risk they do it. One of the risks for them is cybersecurity. So they normally, if you have an enterprise risk management and you are going to work along with them, probably you will have a better way of presenting the concepts of cybersecurity to the higher level senior management, the board of directors better, because they do have a good methodology, a risk appetite statement, likelihood, and then impact categories are well defined. So it's really going to give in a very, very good structure for you to be visible as a CISO or an IT security officer, to be seen at the senior management level or a board of directors level. And I see, but however, when not so much a regulated or maybe not very supervised organizations, where, like example, some of the larger industrial organizations or a trading company in Kuwait, they do not have a very structured enterprise risk management as a department or functions. So probably you can make use of the concept of enterprise risk management, and you can structure your cybersecurity strategy and points across to your senior management. Even though let me again go back to my experience with banking perspective. Even though we all say cybersecurity is a very, very high risk, and it's also probably of happening is largely higher as compared to other risks, ERMs needs to be, ERM works with a number of categories of risk. As Colin talks about cybersecurity, the cybersecurity of physical security And in a banking sector, if you look at it, you have a credit risk, you have market risk, you have compliance risk, legal risk. There are so many risks that you have to be bothered about it. So it is important for cybersecurity team to work closely with the risk department so that their risk also projected or presented well to the management for them to get a budget and allocation of resources, as well as about support from the senior managements to get your implementation well done. There are many advantages as a cybersecurity professional to integrate it, because if you're a cybersecurity professional to present to the senior management, many times they are lost because cybersecurity professionals tend to speak a lot of technical jargons and which may not be really understood well by them. Board of directors, C-level executives are most of the time are a number guys. They only look at in terms of what's the impact, what's the effect, and how do we get this particular things done. To them, talking technically in terms of vulnerability, exploits, port security, it's really Latin and Greek to them. You are not going to get them across. You need to talk the same language of what they are talking about it in terms of risk appetite. How do you address the risk? How do you bring the risk to an acceptable level? How do you give an assurance for them the risk is not exploited? You need to talk the particular language. That language is provided by the risk management department so that you can really break your silo of reporting to somebody or presenting somebody to the deaf ear. Using ARM practice, it's possible for you to reach to the correct level and get your demand accepted. Many times, cybersecurity professionals may not get the the budget they're looking for. Using ARM, you may be able to get it. I'm going to talk about NIST 8286 that provides a fantastic approach, even though there are a lot of other publications available, like a COSO provides an enterprise risk management framework, ISO 31000 provides about enterprise project management. But I thought linking together the NIST's publications together, it might be useful for me to stay with NIST only rather than going out of them. But NIST standard, ISO standard of 31000 all are one and the same. Okay, so what we talk in an enterprise level framework, we talk about identify the context. I think in the previous presenters we talked about it, like for example, Shazad talks about individual security of an FBI agent. After that, Liaz talks about medical records as one of the context or the exposure of an organization. Colin talked about how do you protect the physical security as well as about oil sector. So it's very important for you to understand the context and then accordingly work for it. For example, if you're going to be a cybersecurity consultant or a professional advising to a banking organization, it's important to understand what is the context in which they work with them. Are they exposed to a larger threats? Yes, they are. Are they exposed to a lot of regulation? Yes, they are. Are they expected to be having your cyber defense all the time, 24 by 365 days? Yes, they are. So the context really matters a lot when it comes to analyzing the risk. And also, I would then we'll go to the next box, which is called identify the risk. For example, the risk identifications really differ between the context. For example, if you're talking about a risk exposure to a core banking solution, which handles all your debit and credit transaction that you perform, is different to an internet banking system versus mobile banking system, or even electronic payments gateway, whatever. So in that way, the risk need to be understand and do we context it and then accordingly bring it up to proper things about it. Then you need to analyze the risk in terms of how does it going to happen? What is the likelihood of this particular risk is going to happen? And probably that you know about it in terms of likelihood is going to happen in once in a year or twice in a year. It's going to be frequently happening, or you are to live that it's going to happen anytime. And even if it happens, what is the probability of its occurrence? Will that happen on Friday evening or Saturday evening, whatever that. So there's a likelihood assessment required. It could happen about system going down, system getting hacked, data getting leaked, all that particular scenarios that you need to think about it and work on it. Assess the impact. Okay, if that if a security breach happens, a data breach happens, what's the impact? Am I going to lose money? Am I going to regulator going to come back for a fine perspective, or a cardholder data is going to come back to the bank saying that how my card data has been disclosed to the hacker or to the public. So you need to assess the impact. And then thereafter that you have a simple sort of prioritizing risk, like, what is that my risk is really, what are the risks that I'm facing? How do I prioritize? Not all the risk is not equal or at all equal. So it provides in a fantastic matrices in terms of how do you look at it, likelihood and impact, and come back to a prioritization of whether it's a priority 1, priority 2, 3, 4, 5, whatever it is. And accordingly, you can have a kind of very specific mitigation plans and response plan. And that's exactly that risk management works. And if this concept is applied to our cybersecurity nuances, it really provides you a fantastic way for you to communicate to the ER. For example, it's not necessary that you should have a security exposure of a desktop security to a server security or to a core banking solution system architecture or stacks. So when you do this particular analysis, you will find yourself that you are bringing up a correct profiling of the exposure that you have to the higher management. If for example, if you do not have a controls at a perimeter level, it's going to be a high risk and high environment. So you need to bring in that to a senior management attention as compared to an agent not working in desktops, as long as desktops is insignificant in the computing process. So in that way, if you're using this particular approach, a framework, it provides you a pretty well visibility to you. And that is done through an organization structure, a governance structure. For example, senior executive management, they are going to be looking in terms of what exactly they want the organization to be achieved and how they're going to be making that achievement occur. So they're going to be talk about saying that about, okay, what is my risk appetite? And they're going to define to the CISO or a risk officer. The risk appetite is in a statement or an acceptable level of risk an organization can take it. For example, they can say we have a zero acceptance for compliance risk. They can say a zero acceptance for regulatory breach, zero acceptance for fraud within an organization, something that they can talk about it. But they cannot say a zero incidents in your IT infrastructure. You cannot say zero incidents in security breaches. So they would say that kind of 90-95% of time that you should be available of a critical system, you should have a 99.9% of availability. So these are the level of appetite they create for you, and then you can they will communicate to you. And based on which that you can structure your responses plan. If you have a 99.999% of availability is expected for the management, then you need to look about a lot of redundancies in your infrastructure, data, resources, third-party vendors, geographical isolation. A lot of things has to be done to achieve this particular risk appetite. And accordingly, based on the risk that you're talking, they will also provide you budget. Okay, fine, I understand it. If I am expecting a 99.99 availability, then okay, I got you. You need to have resiliency. This is the budget. Please spend it. And that's the way that you really put up with your presentation to them, and you get your things about it. Once that you got the budget, and then other operational, you'll get on to other work of framework profiling. You will be profiling it. What's a profile of a core banking solution versus internet banking solution? What is the profile of my mobile banking system versus a core banking system or any infrastructure? So you start profiling them, and that brings to a point in terms of how do you do an operational working? Do you need to harden them? You need to bring in agents to monitor? Do you have a security operations center to work 24/7? Do they have to be alerted? Do we have to have all with the time a forensic analysis team to be available with you? All that becomes an operationally easier when you are defining the appetite, defining your profiling. Then comes to an operation become easier. As I said, like how do you prioritize risk? That we have a simple matrices, like we use normally a 5x5 matrices. We have very high likelihood of happening to the very high impact level. So anything in the 5x5, it means anything between the 25 to 20, you consider them very high, very critical, and that has to be first and foremost to be controlled or mitigated or responded back or monitored clearly. And then comes to a high, moderate, low, and very low kind of categorization. So it's become a very clear what are you trying to be protecting and how you're protecting, and you have visibility of them. For example, if you have to protect your cardholder data, the CDE that we call, it's very important for us to protect them very. So we need to have a very high. The very impact is going to be likelihood something going to happen wrong, and this impact is very bad if all the 16 digits of the card number is exposed. So it'll be in a very high kind of profile it gets it, and accordingly work towards to mitigate it and response back to them. And this is a fantastic framework that you can follow to prioritize your own work and get your required budget to protect your data and systems. And this is the way that your profile will go up. For example, if you are going to be integrating with your enterprise risk management department, your system level, the last box that you can see in this particular profile, in this text, or maybe the diagram, you can see that system level cybersecurity risk register. That goes to a lower level organization unit or risk register. That goes to an organization level, then goes to enterprise, then enterprise goes to enterprise risk, and goes to the enterprise profiling. So it's really promoted from a perspective to then a very low stack technical vulnerabilities to the enterprise profile, and it's filtered down based on your risk appetite reporting lines. In that way, it's possible that your requirements for revamping your security posture, revamping your example perimeter defense, or revamping your data security and data encryption methods can probably come up, and you may get a budget for this. And that's a really good. And as I said, if you were to at least to look at a banking perspective, there is a competing demand for a risk management to ask for a funding. You may want to have a lot of data, a lot of budgeting may be requiring to a market risk. You may look for a credit risk. So you need to compete in that same budget to get it. So more that you use ARM, more you'll be able to be profiling it proper to the management and get your budgets. As I said, the advantage of using ARM, the enterprise risk profile is determined by the senior management. Budgets are then allocated to them, so you get your budget. As long as you will get a proper profiling, you will get an because at the end of it, board of directors also wants to take in cybersecurity risk as very seriously nowadays, and they don't want to be missing out of a very larger hack or ransomware attacking, make them non-operational for a couple of hours. It's impossible for them to imagine. Hence, they will be providing the fund to you. Risk appetite statement, we call RAS, is an excellent single source of guidance document for treat the risk. How do you want to treat the risk? How do I treat the risk of inherent risk to a residual risk? What should be done? How do we evaluate? How do we benchmark? It provides guidance in that. There's a greater chance of cybersecurity risk move up the ladder if you go to this management rather than you talk only technical jargons and get lost. And cybersecurity implementation is well supported because it's funded and also supported by senior management. And you have a very common taxonomy across organization of talking same language of everybody. So if a cybersecurity officer works along with a credit risk officer or a market risk officer, all of you will sing same language you talk, rather than you talking technical, that guy's talking about value at risk and all the things. You're going to be talking similar kind of languages to the management. So the advantage is plenty. Please make use of this particular ARM as if you are very best supporter for you, and you can get your work done. Okay, moving on quickly, the next important point, which is very important. I think myself and Dana talked largely about this in many of our ISC Squared seminars, and that is very particularly important for Kuwait as a market. Kuwait is really short of cybersecurity professionals. You really go and get it, resources that you may look for it. And first of all, even if you ask for it, what are you going to ask for it? Are you going to be follow your hunch feeling? Oh, I need to get this particular tester only. Is a tester is going to be required all the time? Is he going to be provide that important work requirement for you? Are you going to be achieving the objective? So you may get lost in asking about tester and leaving out something important profile that you look at it. And this particular work framework again is in a document I'm taking from NIST. NIST developed something called a very nice framework called NICE framework, NICE. And that's really provides you a big good in terms of how you build up your competencies, work roles, and then go for your resources requirement determinations. Right. So NIST special publication 800-181 provides a framework to determine workforce requirements and how do you want them. At times you may want to have also, we find, okay, in Kuwait, you don't get this particular professional all the time working uh, in Kuwait. So how do you do it? Outsource them to different countries, and odds and can be get it and a secondment from any consulting organization. It also gives you a fantastic scope statement for you to define what exactly to be outsourced or insourced. Okay, I'm going to take it up so very slightly bit by bit so that all of us probably understand it. So there isn't a task that we normally perform. Everybody perform that particular task. Yeah. The task is it describes the work that is to be performed. For example, let me say a security operations center, right? Security operations center may have a particular work of monitoring exploit or exploits coming in or whatever, or a use cases being built up to identify their abnormal activity in your entire organization. That's your work. So security analyst is, let's say, is a work that performs. What that particular work requires is a two important thing. One is about knowledge, and then also skill. A knowledge is a retrievable amount of concept or a practice that you should be able to work on them. That's a knowledge. Skill is that something that you're able to perform that particular knowledge into an actionable items. That's what the skill is. So the task is performed through a backing of a knowledge, through a person who will perform that skill-based working, so that the task is gets over. For example, if you are a security operations center analyst number one or analyst number, let's say SOC level 3 person. So let me say level 1 person. Level 1 person is going to be looking into his monitors, looking into the alerts. He's going to be identifying some alerts coming in from, let's say, firewall, someone really doing a scan on the firewalls, and you get a pop-up message on your screen saying that, hey, there's something happening over there. And that person now understands, okay, he has a knowledge, say, hey, this particular device knows as a firewall, some external IP is trying to do a scanning on them, and that I know what to do about it. So he has a skill now to say, should I drop the connection? Should I to unblock the IP which is coming in? What should I be doing it? He has the skills to perform it, and accordingly work on it. And this is the way that you are breaking up the task into a skill and knowledge requirement. So just for the definition perspective, task statement is about an activity that is directed towards achievement of an organizational objectives. Knowledge is about a retrieval set of concepts, and skill is about a retrieval. Oh, I'm sorry, copy down same thing. It is about your experience of performing that action. Okay, now that it's not that necessarily that only one person was employed to perform one single task in a day. So you have multiple tasks. You may have multiple tasks to do it. For example, in our case of security operations center analyst, he may have to come up with a new use cases for them. For example, how do I detect a malware? How do I do a reverse engineering of malware? So some kind of different tasks that you will be having it. And each of the tasks again breaking down into a skill set and knowledge. Maybe some tasks may require multiple knowledge, maybe multiple skill set, or maybe one skill set can apply to multiple tasks. So it's about end-to-end relationship can be built upon it. So that provides ultimately to the work role. So when I say about work role here, I'm talking about security analyst number 3 or L1 support, L2 support, L3 support. You can provide a work profile for a May. This is gentleman is supposed to do this task number 1, task number 2, task number 3, or task number N. For each of the tasks that he has a skill set requirement, a knowledge set requirement, and as long as he meets it, he is expected to be performed good quality of the output that is expected from him. And that's where you built up your to the higher levels. Then the competency is coming up to the task. what is the competency of mine, how my credential is. Okay, I am a IC squared CSSP certified person. My competency is that. My competence is that not only that I have demonstrated and my knowledge to an external third party like IC Square, which provided me a CSSP certification to me, and that really requires of one of the position requirement of the position. If I'm going to be in a, for example, investigator, forensic investigator, then I may have to a CFE as a thing or anything related to SAN certification of a forensic investigator. So you have to bring in the competency along with them and then bring it up as in a position descriptions. So like this, if you look at it, we are going to be working from the bottom up to the top. So from the work role, we're going to go a specialty area, from specialty area to category, and accordingly, we're going to be doing it. For example, as I said, a specialty area in this is could be about security operations center. Another specialty area could be about information security governance and risk management. Third could be about network security or infrastructure security. Fifth one could be your data security. So a lot of security specialties is now coming up to the role and categorized to one particular area. That's what is slowly building up one by one to the top position. And I'm giving some example as I got it from the NIC standard. For example, if it's going to be a work role of a person, what is going to do it? So to perform the role, he has to have designing capabilities of work. He has to be in a solution security architecture required, a solution developer skill set required. All of them are required. Like this, you can build up your role slowly, and also to say for me to do a identify, protect, direct, respond, what should be having in that particular perspective. And the good thing is about the framework is really developed a very large set of competencies. To be honest, there are 7 categories, as you can see in this diagram. You can have these are the competency includes 33 specialties areas. Those 33 specialties areas consist of 1001 tasks that has to be normally performed for an organization. And then those particular tasks require 630 knowledge credentials. And also you have a 374 skills requirement for them. And then you have 106 abilities to be performed them. So the good thing is that someone is really like NIST has developed a fantastic framework for us. And it is a very good documentation. It provides a fantastic details in terms of what task, what skill set, what is the knowledge required, and how we can scale up. And accordingly, you can probably use these systems to build up your workflows in requirement. Okay, I need a person to do an IS governance, security requirement, or I can combine them together with a governance person. I don't need to have a separate security person because my organization is not large. So you can do a use in a way that your organization requiring it. In excellent documentation. The only one advice NIST provides you is that please do not modify this particular risk when you're doing it. Probably if you feel there's something very important coming in, you can add a new task or a new skills or a new knowledge base and accordingly work in rather than modifying the existing the components given out here. Going further, so if I'm saying about if you are going to perform in a categories of analyze as in one of the category, it requires a 3 specialties area: threat analysis, exploitation analysis, and all source analysis. And that each of them require a set of work role: threat and warning analyst, exploitation analyst, all source analyst, and missions assessment specialist. And each of them have a work role IDs created, and that provides you a description of what that particular work role is going to do it. For example, in my organization, for example, if I'm not a very larger organization, I may not require a mission assessment specialist. You can ignore them. You can probably take it up later. If you have a very short budget available, you can probably combine threat and warning analyst and exploitation analyst to one single role, and that you can work that up because it depends on the exposure and threats that you are facing. You can probably do this particular thing. For example, if you're looking about a target as a second specialties area, your target developer, target network analysis, all of them are provided in the NIST standard. And this is a fantastic framework for you to use it and then determine it. And then you have you can build up your case of how much requirement you have it, how many resources FTE that you require it, or if you do not have an availability within FTE, can I go get an outsource arrangement from a service provider, and what kind of scope that I should be defined. Many use cases for this particular framework. You can use them effectively for your determination of your resource requirement as well as about work to be done. Again, my objective is to not to take too much of information, but provide an introduction about NIST publications, and probably, if you like, in ISC Squared, we'll be more than happy to assist you and get some guidance if required. Thank you very much. Back to Dana, to you.
Thank you. Thank you so much, Cynthia. That was fantastic. And I would like to just share briefly this document that follows up what Cynthia was talking about. This is a document that we published from the NIST working group. NIST is the National Institute of Standards and Technology in the US government, and NICE is part of NIST. It means National Initiative for Cybersecurity Education. I've been on that working group since 2016. This is one of our first products titled Cybersecurity is Everyone's Job. I recommend this document for everyone. Take it to your company, take it to your organization, take it to your enterprise, and help everyone to understand that cybersecurity is not just the responsibility of a few IT people. It is everyone's job. Everyone has a role to play in cybersecurity. And I hope that that is the message that we've been delivering today, and that everyone is very clear about it. So now we will go to our breakout rooms where we can ask questions of the presenters, and we can have discussions with them. As Colin said, the presenters are very ready for you to challenge them and to help them to talk about or discuss their theories and their presentation. You're very much welcome to join a breakout room. You should be able to see someplace on your screen where you can join the breakout room that is on the subject you would like to join first. So we have breakout rooms for oil and gas, and Richard and Colin will be there. And we have a breakout room for cyber-aligned counterterrorism. I will be there. And Shahzad will be there if he's able to. And we have a healthcare breakout room and banking breakout room. So you should be able to join the breakout room of your choice from your screen. So you can go ahead and do that now. But anyone who's having difficulty joining, we are able to move you to that room. So I'm going to be joining the breakout room for cyber-aligned CNT. Shahzad is in there. I'm not sure that he is able to join with us, but I will join that room and welcome anyone else who wants to join that room.
Thank you, Dana. And whoever's having issues trying to enter that room or any of the other rooms, just let me know and I can put you in manually. So the nice thing about the rooms, by the way, is that you get to have a discussion with them, further discuss. And of course, as Colin said, if you have, other arguments towards what they mentioned, that'd be a very nice time for you to discuss with them. All right, so I'm getting requests. Healthcare. If anybody else wants to join any other breakout room, please type it on the chat if you're unable to do so by yourself.
That's a good approach, Paula. So I'll leave it with you, Paula, to help people get into breakout rooms.
Yes, absolutely.
Okay, and I'll be in the CT room.
Perfect. Syed, do you mean oil and gas?
Who, me?
No, no,
Oh.
Syed Basha. He said, can you put me in break? Okay, I'm putting you there. Shantilal, I will put you in, I think the cyber alignment would be good for you. 1 second. All right, anybody else who would like for me to push them into a breakout room?
Okay, I'm wondering if we have a bunch of connections here that are not live.
That could be possible, Lena.
So let's check one by one. Ali Yusuf, are you there?
And by the way, if you do not wish to join the discussions, please feel free to, enjoy the rest of the evening. And if you don't feel comfortable in being part of the discussions, you can also send us questions afterwards, which we can present to the presenters and send back their answers. So thank you to everybody for joining. And again, if you would like for us to assign you to a breakout room, just please type it on the chat. Thank you.
Paula, can you push me to the healthcare, please?
Absolutely.
Here, it's Vanna.
All right. And by the way, even if you guys are not participating in discussions, if you just want to listen in, please feel free to let us know and we'll push you into a breakout room as well.
So Dr. Musayed, are you there?
Hello?
Yeah. Dr. Musayed, would you like to join a breakout room?
No, I'm here. I'm just waiting because soon I'm leaving, so I don't want to commit myself. It was so interesting. I'm trying to figure out how to say thank you very much for presentation, for everything. I sent the question, and hopefully I could hear from Colin now or some other time. Dana, thanks a lot. Much appreciated.
Okay, thank you, Dr. Musayed.
Pleasure. Bye-bye.
Okay. Okay, Taj, you were one of the first people in the meeting. You were the first person in the meeting. Are you there now? Hello, Taj. Okay.
Yes, I'm here.
Oh, you are here. Okay. Taj, do you want to join a breakout room?
Nothing.
No? Okay. What's your job, Taj?
See, I'm the trainer.
See, I'm the corporate trainer for cybersecurity and network security.
Okay, good. Did you find the NIST workforce framework interesting?
It's very interesting, especially the last two speakers were very informative.
Yeah.
Which could help
Okay.
where we stand. As per I understood, more people require to educate about the security breach.
Uh-huh.
So
Okay.
as 95% people do the mistakes like human error, which doesn't know about it.
Yeah.
Most of the people, they do mistakes by human, not from internally 43% as per the slides.
Yes, exactly. So actually, the human resource department and the training department are very important to cybersecurity.
That's the reasons I was very interesting to join this amazing session. So it was
Good.
very informative because that way we stand. Most people required to educate, especially for the cyber security, network security. Now it's cloud security as well is required.
Yeah.
It's very helpful for me.
And did you come to this meeting through OSAC or AmCham or ISC squared?
I came from I think from one of my brother have sent the link to register because you are the educator. So it could help for because I am the trainer. So it could very helpful for you to see what's going on, especially for the cybersecurity for all sectors like healthcare, oil industries, trading,
Okay.
so WHO. So most people doesn't know that. He said, okay, it's cool. Last week I have registered myself with my Abdul Ali Khan. So we work in Kuwait for almost 2 decades.
Yeah.
He also worked in Kuwait oil tanker company.
I see. I see. So is he in the American Chamber of Commerce himself, or do you know?
Not yet. I
Not
would
sure.
like to. Yeah, I'm sure.
Okay. All right. Thank you. Thank you, Taj. What about Akram Kamal? Akram Kamal, are you there? Hello, Akram. Akram, are you really with us or just appear to be connected?
I think that might be the case. So Akram is actually our board member.
Oh, really?
With, yeah. He's with
Okay.
Belmonte.
Okay.
Yeah. And I will just let you know, Bedit is also with us, with our team. Jensen is with our team.
Who is that?
Jensen and Bedit.
Oh, yeah, of course, Jensen. Yeah.
Yes.
Yeah. Okay, what about Prubas? Hello, Prubas. No. And I see Mauricio, but he's having a connection issue. I can see that his connection to audio is on and off. And I called on Ali Yusuf before. You can tell I'm used to teaching online. Okay, Ali Yusuf, are you there?
Well, you know what, Dana, I think if anything, if people are not there, we can just go ahead and join the other discussions. And I'll keep an eye on the main lobby, just to make sure that we're not missing anything.
Yeah, sounds good. Sounds good.
All right.
And then depart to this. The second part is the biggest and most challenging is people understanding